Hello, my name is Catherine Rutland and I'm Clinical Director at Denplan, part of Simply Health. I'm recording this message at a really difficult time for the profession. We're in a situation that hopefully we may never be in again. But at the moment, what is confusing and causing deep anxiety to many practices is the lack of clarity of information that has been provided. One thing that I would say is that it's really important at this time when we do have clarity on other areas. So, for example, our family lives, are the problems with people who are now being told to self-isolate for 12 weeks due to their health conditions. These areas as well have sat in limbo for a little while and then have gained clarity. And that's where we are with dentistry at the moment. Clarity will come with some time, but obviously appreciate that in the meantime, it's really frustrating. What's really important to do is make sure that you kind of guard yourself a little bit from everything and all the bombardment that is out there. It's very easy to get hauled in by social media, what's being said, what other people are feeling, other people's fears, but really important that you actually look at the guidance and what is then how you are going to work for your practice, your staff and yourself and your patients. It's going to matter and depend on jurisdiction you live in. It's also going to depend on the demographics of your patients and also your staff and any health conditions that are already existing within that. What I would say to you at the moment is one of the most important things is to make sure that you communicate well with your patients. They are all in this in different ways themselves as well. They do know it's happening. It's not like normal practice situations where quite often we're trying to communicate about something that's happened internally and our patients aren't aware of and don't understand. This is a situation that they cannot help but be aware of and have a huge amount of information about the risks associated with it. And although it sounds awful, in a lot of ways it makes your messaging much easier. What I would do as well is make sure that communication fits you. We try to help by providing some templates regarding patient communication, but make sure it sounds like yourselves, make sure it's the sort of thing that you as a practice would want to do and how you're working. What I'm hearing at the moment is big variety of what practices are doing, and that needs to be reflected in the information that you give to your patients. As with all businesses, although we've been planning as a company for some time with this coming, the speed that it has taken upon us in the last literally 10 days has meant that we've been in a situation of having to get all of our employees outside, and we therefore are making sure that we try and attain the service levels that you expect from us at this time. We will find that there are times when we will be able to provide you with further clarity of guidance, certainly from a clinical perspective. I have a team around me that feed information into me constantly, and we're constantly watching what is going on. We will update. There are blogs on our website, and for those of you who have access to the portal, we will be putting more information in behind the portal as it comes. But as I say, we have to go by government guidance. We can't make this up and clarify anything differently. So would I ask that those of you Denplan members, please keep checking, keep in touch with your consultant to see what's happening and how they can help you, and certainly how they can help you with patient messaging. One of the other areas that we've been asked quite a bit about is patient retention. Obviously, we want to help you to retain those patients. We've been asked around patient care and ethics of taking payments off them if you're all but closed. But again, Denplan care certainly and essentials are based on spreading the cost of treatment over a year. Now, as it stands at the moment, we really hope we aren't going to be closed for a year. Who knows at this stage, obviously, but we're hoping that we will be back open and being able to provide some service within a few months. And if that's the case, your patients will then be able to draw on that treatment that they would have done the same as anything else. So I would like to reassure you that is the message we would be providing to your patients, and I would certainly recommend that it's the information that you give to them too. I do fully appreciate that many of them will be financially very stretched at the moment and will be concerned about keeping up their payments. We do know from previous recessions, which I know again is a little bit different, but recessions that have occurred is that actually patients on a payment plan do stay on it for long periods of times. It's one of the last thing very often that they actually choose to cancel. So with good communication from yourselves, with us helping to back you up on that, retention is something that we can all work on, and obviously it gives you some stability within your business. I don't want to say too much more at the moment because it's a constantly changing situation, but we are here. We are trying to gather the information, get it to you as soon as we can. We're compiling any questions that you can provide or ask through your consultants, or also any questions that your patients are asking. And we want to work on those. We will keep doing that, looking at them. Some of the things that have arisen require some bigger business decisions that is out certainly of my clinical head remit at this time. But please rest assured that we are looking at all of these things. Hopefully over the next few days we will get some further clarity on some of the issues that are causing such concern. And please, I wish you well. Look after yourselves. Priority at this time has to be each of our health, our patients' health, and also our staff's health. I'll speak to you soon. Bye-bye.